Hi, Dr. Bhatti. How are you doing? It's such a great honor and pleasure to interview such a long time and highly experienced doctor such as you.
In this video, in a one-on-one session with Doron Harati, our international representative based in Tel Aviv, Israel, we'll be discussing a few aspects of hair transplant, questions which come to the mind of Doron Harati.
I got so many questions to ask you. How about we are picking professional clinics and how we are avoiding the black market clinics?
Everybody has different questions, everybody has different priorities, everybody has different anxieties and objectives, on the basis of which different questions come to the mind of different people. And in case of Doron Harati, an ex-bad hair transplant survivor, so his questions are a mix of what a representative would ask and what a patient would ask a doctor. We have had several question answer sessions with other celebrities and other patients. So this covers a broad spectrum of people. And once you go through these questions and answers, most of your queries before a hair transplant are answered. That empowers you to do your research and to select your hair transplant surgeon and to even decide whether you should go in for hair transplant or you should be happy with medical treatment only, or you should let go of the thought of getting hair transplant or any hair loss treatment. So this is the basis of these talks. These talks are unbiased. These talks are not meant to solicit you as a patient. They're just to empower you with information so that you can make your decision the best way you feel appropriate. So Doron Harati underwent a bad hair transplant. In my previous video, I have explained to you all the aspects of a poor black market clinic to which Doron Harati went and how he survived a high dosage of anesthesia. He was resuscitated in a neighboring hospital from where he recovered, and today he lives to tell this tale.
What are the dangers and risks at the black market clinics? On my first procedure at the cheap clinic at Turkey, I almost died. I almost lost my life. And this is very, very serious because I trusted the agent. The agent, he was my barber and my friend, so-called friend, for 14 years. And he took me there, and it was just terrible and awful. I felt pain during the procedure. And in the last 2 hours, I started to feel nausea. And I told the technicians, listen, I don't feel good. I need to go to the toilet. I have diarrhea. I need to puke. And they don't know English. So they did me like this and shut up, shut up, shut up. So I had no other option. So after the procedure was finished, the agent and the translator came and they told me, okay, Doron, now you can get up. And I told them, listen, I can't feel my body. I feel nausea. I just can't. So they pulled me up and I threw up and fainted. It was a black screen. And then I remember when I woke up, I was on a wheelchair. And for 12 hours, I puked and I had diarrhea and I shivered all over and I didn't feel my body heat. It was awful. It was the most horrific experience I ever had experienced in my entire life. So I started to cry. I told them I just want to go home. Please, I want to go home. And they called a hospital, and an ambulance came with paramedics and a doctor. And the doctor infused me with water and said, listen, your life is in danger now. You were poisoned. You were overdosed by anesthesia. The anesthesia has adrenaline, which causing you a low blood pressure.
So Mr. Doron Harati, please ask me your questions.
So let's start from the beginning. Please tell us about when and where you're starting doing hair transplant procedures and when you found in the Darling Buds clinic.
I am a trained plastic surgeon. I am in this field since 1996 and I underwent my training in India at the Armed Forces Medical College in Pune, where I did my undergraduate studies, postgraduate studies as a general surgeon, and then went on to do my postdoctoral study in plastic surgery in 1996. Thereafter, I had a keen interest in hair transplant surgeon and cosmetic plastic surgeries. I had the good occasion and good luck to have been recommended to do further training in cosmetic surgery in the United States. And there my professor who is no more and God bless his soul, Dr. Ian T. Jackson of Southfield, Michigan. Seeing my interest in hair restoration surgery, he phoned up a neighboring doctor who has high repute in the field and who in those days used to write a lot for Ian T. Jackson's recent advances in plastic surgery and used to cover the field of hair restoration surgery for him in these recent advances books. He was happy to have me with him for a few weeks on the sole recommendation of Ian T. Jackson, because in those days it was well nigh impossible to train because people would not allow you to train under them. Hair transplant was a hush-hush affair. They wouldn't let the knowledge out. So in those years, I trained under Dr. Tesla of Michigan for a few weeks. Following this, I have gone to multiple centers all over the world, the best centers in FUT surgery and later on in FUE surgery. And then I started my own practice in Chandigarh, my hometown, in 2008. And that is when Darling Buds Clinic was established. And we've been doing great since then. But in 2011 end and 2012 beginning, we started doing only FUE hair transplants. We started doing FUE in 2006. But after 2011, ours was the only center in India where 100% FUE was offered to the patients. Those were the days when there was a lot of interest in FUE, and being one of the front runners in the field of FUE, a lot of doctors from India and abroad came to us for training, though we don't run any training centers now. Those days, we trained in a matter of 2 to 3 years, almost like 250 doctors from India and abroad in Darling Buds Clinic. We used to hold a lot of conferences, a lot of hands-on meetings, FUECon, but we don't do it anymore because now our patient load is such that it does not allow us to do the teaching program. So today we are doing only FUE hair transplant. Our center is a 100% FUE hair transplant clinic. We do not do any plastic surgery now. We do not do any cosmetic surgery procedures or any other procedures like lasers, fillers, Botox, etc. It's only a purely hair transplant clinic, and that too purely 100% FUE hair transplant using Anagen Q+ technique.
What are the tools are required by a professional clinic, and what kind of tools the black market clinics are using?
Mr. Doron Harati, FUE is one field where tools take a back seat. Tools are just what they are. A good hair transplant clinic is one which does good hair transplant counseling, does proper case selection, does not take up all cases, only takes select patients whom the doctor feels will benefit from a hair transplant for a longer period of time. A person whose donor areas will allow enough grafts over a period of time to meet the patient's future objectives. A patient whose donor area is strong, is stable, and is not maintained by DHT blockers. A good hair transplant clinic is one which decides whether the patient is fit for hair transplant or only for medical treatment or for both, and gives the choices to the patient for him to decide without any bias, without any duress, without any inducements or allurements of discounts, etc. on his own, without pressure. An unbiased approach is encouraged by a good clinic. So once these inputs are given to the patient has to decide whether he wants to go in for hair transplant at all or whether he is only going to be happy with hair loss treatment. So the best tool of hair transplant is an honest, ethical, and unbiased consultation and case selection. Secondly, more important than the equipment, the instruments that we use, is the team. Hair transplant is a long procedure. One person cannot do a hair transplant procedure. So this team has to be adequately trained. This team has to be a team which has been with you for a long time. There should not be too much of attrition in the team. The team should be open to newer approaches, to newer techniques of hair transplant, and have an open mind to incorporate new methods, new technologies, and new skills into the way of doing hair transplant. Should have the ability to incorporate these new techniques and new skills into their practice. Besides these, the tools that we use for our Anagen Q+ technique is very good magnification. Magnification while harvesting, magnification while dissecting the grafts under the microscope, magnification while making the slits in the appropriate direction and appropriate depth, and magnification while doing the plantation. The FUE motor should be such that its torque is appropriate and it does not produce too much of heat that will kill the grafts or spoil the stem cells. The other instruments that we use for a good hair transplant in our Anagen Q Plus technique, and there are several videos that I have made in which I have explained the Anagen Q Plus technique, is the implanter pen. The implanter pen is used for the rows behind the leading edges of the hairline. Implanter pens allow for proper non-traumatic placement of grafts. It also decreases the out-of-body ischemia time.
And what kind of punch tool you need for Afro hair procedure?
The punch. What is the punch used? Whether the punch diameter is optimal for that particular patient. A big punch for a small follicular unit will be an overkill because it will produce more scars than are required. A smaller punch for a bigger follicular unit is also not in order because it will produce too much of transection, which will spoil the results. So for every patient, the punch size has to be different. It is not that a clinic advertises that we use only 0.8 mm punches. Try using a 0.8 mm punch in an African American. Try using a 0.8 mm punch in a South Indian. There will be too much of transection. There will be hardly any growth. So punch size is variable. What type of punch you use, whether it's a sharp punch, whether it's a semi-sharp punch or a dull punch, also is dictated by the type of skin, whether the skin is hard or the skin is very soft. In a very soft skin, if you use a very sharp punch like the coal punch, which I use off and on, will transect all the hair. In an African skin or a thick Indian skin, you have to use very sharp punches like coal punches. And there are various other punches like the trumpet punch. Our splayed punch of 2010 was the forerunner of the trumpet punch. Everybody knows that. So I would like to say that the punch size, punch diameter is dictated by the follicular unit size and not by the patient, that I want to use only a 0.8 mm punch or I want to use only a 0.7 mm punch.
How much you can cover a scalp area with great density if you have a good donor area within one session?
Yes, that's what most patients who are traveling from abroad want. A procedure done one time that lasts a lifetime. The patient does not want to come again and again, and he weighs the entire economy of the whole procedure. He calculates it. And if you are a clinic offering a two-stage procedure, it is not likely that you will be his first choice. Because this patient is penny wise. Because he wants to optimally utilize one trip to your country to get his hair transplant and doesn't have to and does not want to travel again because that will add to the costs of the hair transplant. However, in most cases, this is like asking for the moon. If a patient has a very good donor area of the scalp and allows 3,500 to 4,500 grafts from the safe zone of the scalp donor area, and if we can harvest about 1,000 grafts from the beard and about 1,000 grafts from the chest, most scalps, even grade 6 scalps, can be covered with these many grafts over a 2 to 3 day session. This is not the case in most patients, however. The scalp donor of most patients does not allow more than 3,500 grafts and about 600 grafts to 800 grafts from the shadow area of the beard under the jawline and about 600 grafts to 800 grafts from the chest between both the mounds. So these are the areas, the permanent zone of the scalp, the shadow area of the beard, and the intermound area of the chest, where the graft quality is good, where you get most anagen grafts. So in our technique, we aim only to get anagen grafts, so the patient's results are good and the patient's results are long lasting and the patient's hair are not dependent on DHT blockers for the rest of their lives. Because these are permanent grafts and these are taken from the safe permanent zone only. Most clinics will advise you 6,000 to 8,000 and even sometimes 10,000 grafts in one session. Well, that is adventurism. This demand of patients traveling abroad and asking for more grafts per session has led to the evolution of new names to overcome the guilt you have as a surgeon of transgressing the safe permanent zone, and terms like extended scalp donor, extended beard donor, that is coming onto the cheeks and the sideburns, an extended trunk donor that is not taking the grafts from between the two mounds of the breasts, have come into vogue. These grafts, which are taken from areas which are non-permanent, will be short-lasting, or they will be dependent on DHT blockers like finasteride for the rest of your life. So it is good to be economic with your travel because everybody can't afford multiple occasions on which to travel. But at times, being penny wise will land you in a lot of trouble. And to revise that procedure, which was misconstrued, where the grafts were harvested from areas which are not permanent and they shed off, will make you seek more and more revisionary procedures to sort out that one time when you wanted to save money and you were penny wise. So follow the advice of doctors who work in your best interest. You may not get your hair transplant from them, but take their advice. Ask a lot of doctors, ask a lot of clinics. Don't fall for the advice of just one clinic, because that clinic might not be working in your best interest. That clinic is an expedient clinic. They are just trying to merely lure you into getting as many grafts as you want, playing on your misconceptions that you have abundant grafts in your donor areas and that grafts in the donor areas grow back. If you know the basics of hair restoration, and if you know the pros and cons which you need to weigh before taking the decision of a hair transplant, and you have done your research, you would know that one session for a person who's grade 6 and grade 7 will never be sufficient.
Why Afro hair procedures are more demanding and complicated?
As I told you before that I was doing FUT procedures till about 2011 along with FUE procedures, and I stopped doing FUT procedures in 2011 December completely and devoted my life and time to the evolution of FUE in my clinic. And we have been very happy that over a period of time, FUE technique has singularly evolved, which outdoes FUT procedures. In many other videos, I have told you the reasons why FUE is far superior than FUT procedures. Whether FUT is any more the gold standard of hair transplant is for you to decide. Because very few people now today go in for FUT hair transplant. Most FUT hair transplant surgeons who are accomplished surgeons the world over have switched over from FUT to FUE hair transplant. But there are clinics which offer today only FUT hair transplant. Well, these are clinics, if you research further, you will easily come to know that these are the clinics which are not pure hair transplant clinics. These are clinics in which one of the procedures they offer is a hair transplant. If you don't believe what I say, please research it. The doctor will also be doing lasers, fillers, and multiple other dermatology procedures or plastic surgery procedures like rhinoplasty, liposuction, and so many other things. So hair transplant is just one of the procedures offered by that clinic, and that is the clinic which encourages you to go in for FUT only. This is because FUE is a laborious procedure. If a doctor has to do the FUE himself, that is the FUE harvesting and the slit making himself, he cannot do any other procedure throughout the day. It's a very demanding procedure. It requires a lot of training of the staff. In my clinic, our USP is that we are a one doctor, one clinic, and one patient center, and we do only one case in a day. Why? Because in FUT, you cannot devote your attention to more than one case in a day. This will make your results suffer. Whereas in FUT, the time spent while harvesting by the surgeon is just about 20 to 25 minutes while harvesting the strip. In FUE, the harvesting of scalp grafts, if you're doing about 3,000 to 3,500 scalp grafts, can vary anywhere between an hour and a half to 2.5, 3 hours. So that's a lot of time taken off the doctor's schedule while harvesting the grafts. An FUE surgeon therefore cannot afford to do a second case or to engage himself in activities in his clinic which are other than hair transplant. So FUE is a demanding, precision, and skill-based specialty. It is today the dominant hair transplant technique in the world. Most leading hair transplant clinics the world over have switched 100% in favor of FUE. Lectures dealing with FUT do not dominate hair transplant conferences anymore. The future of hair transplant is new techniques, newer skills in FUE only. Well, that is my perception of the hair transplant industry.
Women's alopecia is different. What women should know before applying for a hair transplant procedure?
Yes, female hair transplants are different because in females, the cause in many cases is other than genetic. In females, hair loss can be due to several factors. It can be nutritional, it can be hormonal due to hypothyroidism, it can be due to polycystic ovarian syndrome, and a host of other reasons can cause thinning and hair loss in women. So women need to be counseled much more than men need to be counseled. Women need to be worked up through lab reports and other tests by endocrinologists, which is not the case in androgenetic alopecia in males. And in males, global thinning or global hair loss, that is, the whole head thinning and the lack of a proper permanent safe zone at the back of the head is a rarity. In women, we do not have the luxury of aiming for body hair grafts. In women, the number of grafts that can be harvested in one session is much less than in men. So these are the reasons in women that we cannot cover the whole head with grafts, unlike in men. In women, hair transplant in most occasions is a camouflage procedure to disguise the balding by strategically placing the grafts, optimally utilizing the available graft. Yes, it is different that a female who has a head full of hair, good quality hair, but has a high forehead or a wide forehead, wanting to come for a hair transplant, that is a different story. Because in her, as many grafts are available from the safe zone as it is in men. Lowering the hairline in women who do not have thinning or balding is sought after today, and in these cases, a lot of grafts are available. But for women who are thinning, it is not the same as in men. Hair transplant has its restrictions. Hair transplant has its shortcomings while treating women. Well, thank you, Mr. Doron Harati.
So I'm asking you to do a deep research before you are going to a procedure. You can always ask me even if you're not intended to do a procedure. I'm always on my Facebook, on my WhatsApp. You can always ask me questions with no obligations. So I'm always here for you, and good luck. I wish you all the best and all the luck, Dr. Bahati. It was a big pleasure for me to interview you. I hope many people will get educated by this video. You truly deserve to be one of the top 20 best surgeons all over the world. It's also an honor for me to work with you, and we'll be in touch very soon.